continues to ravage long-term care homes throughout the GTA.
We don't know if there's actually someone to feed her, and that's the major concern. And that was caused a lot of the confusion and a lot of the shock and surprise about our grandmother's passing.
Family members of those inside a Scarborough long-term care home are pleading for more to be done as the deadly outbreak continues to take more lives. Plus,
we have to fight this battle with the same vigor that COVID is fighting us, and right now COVID is winning this war.
some medical experts are pointing fingers at the province over its decision to pause vaccine distributions over Christmas and Boxing Days. And
so I haven't been able to, knock on doors and talk to people regularly, which has definitely been a con.
running a campaign to land a spot as a city councillor is hard work, but doing it amidst a pandemic comes with a whole new set of challenges. Good evening, I'm Kelda Yoon. The death toll from COVID-19 at one Greater Toronto Area nursing home has now risen to 43. More than 40 staff members are also now isolating at home, with more than 100 infected. As Tali Ricci reports, families say they are desperate for information about their loved ones.
We don't think our grandmother got the care and, that she needed.
Dennis Chu's grandmother tested positive for COVID-19 earlier this month, but he says the family was told by staff at Tender Care Living Center that she wasn't showing symptoms. Days later, she died.
The home sent a photo to my father of my grandmother on her deathbed. The color of her skin was like yellow. Her face she looked like a ghoul.
Chu worries she wasn't getting the hydration and nutrients she needed. The home is now in a temporary voluntary management agreement with North York General Hospital. It says physician staffing levels at Tender Care are strong, but there's an immediate need for more nurses. Families have started their own group to swap information.
Some of the residents are still mobile and able to speak, so they're telling them what's going on. And they said, some people it's 3 o'clock, they still haven't had lunch, what's going on, and they're trying to go to bed, and no one's coming to help them get to bed, go to the toilet.
Concerns about staffing are also being raised by families with loved ones at Fountain View Care Community in North York, run by Sienna Senior Living. Shamir Kanji's father tested positive.
They're caring quite well. I just think they're short of resources, especially nurses. And that's the only thing that bothers me.
CBC News obtained an EMS report last week on a patient at St. George Community Care Center, also run by Sienna Senior Living. It read, the patient was lying in bed, ashen, completely naked, with no reverse isolation measures in place, and the door was wide open to the hall, adding that minimal to non-existent protections were in place and that staff completely ignored them. A statement from Sienna Living to CBC News did not address the specific situation involving that patient, but it said in part it's working around the clock with their partners to care for residents and support team members at St. George Care Community and Fountain View Care Community, adding they've implemented a comprehensive action plan that includes stringent infection prevention and control protocols and isolation precautions for their residents. Back at Tender Care, North York General Hospital says progress is being made to manage the outbreak, but families continue to share what they learn from each other, including Chu.
It's already been too late for some of us, but there's still a chance for everybody in there still.
The Ministry of Long-Term Care said in a statement that it's using all tools available to help keep residents safe, adding that homes can now refer residents to a specialized care center, which is providing space to long-term care homes that are facing outbreaks. Talia Ricci, CBC News, Toronto.
The Ford government is facing questions tonight about the COVID-19 vaccine rollout in Ontario. Just over 13,000 doses have been administered so far. As Greg Ross reports, some are asking why vaccinations were slowed down over the holidays.
A little disappointed, to be frank with you.
This emergency room doctor is among several healthcare workers who have been critical of the province for slowing the distribution of vaccines over Christmas and Boxing Day.
This virus does not take weekends off. It doesn't care about holidays. So we have to treat it with the same vigor and the same resolve and fight as COVID is fighting us.
It's also become a political issue, with opposition leader Andrea Horwath taking aim at the Ford government today in a statement saying it's disheartening and frustrating to know that tens of thousands of life-saving vaccine doses have been sitting in freezers. To date, the province's website says that just over 13,000 vaccinations have been administered of the 90,000 reported doses that were delivered to Ontario.
The government of Ontario, no matter what party's in power, does not lead the delivery of healthcare ever. That is left to hospitals and primary care and other frontline providers.
Kevin Smith is the CEO of the University Health Network, which oversees several of the hospitals currently administering the vaccine. He defended the decision to slow vaccinations over the holidays, suggesting that overworked staff need a break.
I don't think it's either productive, collegial, or respectful to say, gee, I think you should have done more work, when those workers who've been out full out said it would be good to have Christmas and Boxing Day off to recharge and come back at this full swing.
But many doctors have said they would have volunteered their time to help out over the holidays.
It's reasonable to put the word out there. It's reasonable to have the resources in place, and I think physicians will respond if the need is there.
But Smith says it's simply not that easy.
Before that needle gets close to an arm, it needs to be drawn up, mixed, put in a syringe by pharmacy staff. These are not staff who are growing on trees.
According to the province, 5 clinics reopened yesterday to start administering the vaccine. 10 were in operation today, and all 19 vaccination centers across the province will be up and running tomorrow. Greg Ross, CBC News, Toronto.
Now, the COVID-19 vaccine requires 2 doses given 3 weeks apart. The province said today it no longer needs to hold back doses for those second shots. In a statement, Health Minister Christine Elliott's office writes, upon receiving an additional 90,000 doses of the Pfizer vaccine from the federal government on December 21st, we have continued to administer initial doses to thousands of Ontarians. We are not holding or reserving doses and are vaccinating as many people as possible, counting on confirmed shipments of the vaccine that will arrive over the coming weeks for second doses. And meanwhile, officials with the main testing lab in the Ottawa area say the new COVID-19 variant is concerning given its higher transmission rate, but they don't think it will overwhelm the lab system.
Play this game every year with flu. We never know what flu is going to hold for us. And so we do have in place some measures and capabilities to enhance our capacity if the need arises. But it's a question of keeping surveillance and making sure that you're ahead of the curve, so to speak.
Health officials in Ottawa say the best way to ensure that the health system isn't overrun by the new variant is for everyone to follow the health protocols already in place. 2 men in Chatham-Kent have been charged after holding back-to-back church services over the weekend. More than 100 people attended each gathering without wearing masks. The events took place Saturday and Sunday around 11 a.m., both at Old Colony Mennonite Church in Wheatley. The men were charged with failing to comply with a section under the Reopening Ontario Act. Well, healthcare workers in Ontario's ICUs have seen firsthand how COVID-19 is impacting families. This month has been particularly difficult with an increase of patients being put in intensive care units. Nicole Ireland has more on what's happening inside hospitals.
Andrea Britchford is a respiratory therapist in the ICU at Toronto General. The first COVID-19 patient she saw was a transfer from another hospital.
And I remember feeling nervous and sort of staring down the hallway, watching to wait for EMS to bring this patient. When he arrived, it was a young person. They were young, they were fit looking, they had been previously healthy.
Back then, hospital staff had a lot of reasons to be nervous. Knowledge of how the virus spreads was limited. ICU nurse Kathleen Saunders worried whether her PPE was enough.
I would separate myself from my family, so use like a separate washroom, sleep in a spare bedroom. But now that we've been at this for months and we're seeing that the protective gear that we're using is working to protect us. So my family is feeling a lot better, and so I don't have to feel so separated.
But inside these hospitals, there's still a feeling of anxiety as staff watch the numbers of cases climb.
As I watch the news and I see numbers going up, I'm like, okay, wonder what work's going to be like tomorrow.
One thing that never gets easier is talking to distraught families.
A lot of times these people come in and they get sick, and it happens very quickly. Sometimes it's hours or days, and all of a sudden they're on life support in the ICU when a couple of days ago, you know, they may just have had the cough or the fever, and to be touched by it personally and see it is very hard for them.
Especially when they can't go into their loved one's room, and nurses who must keep their distance are limited in the comfort they can provide.
You don't feel like you're, you know, sort of right there to put your hand on their shoulder to, you know, offer the support, you know, when their loved one's so sick.
But what keeps frontline staff going is knowing they're doing the best they can to save their patients. Bridgeford still thinks about that first COVID patient who recovered.
And I would just want to ask him, like, how he's doing. Yeah, how are you doing? How are you feeling? And that I'm just so happy that you're okay.
Nicole Ireland, CBC News, Toronto.
And this is a live look at Parliament Hill in Ottawa, currently -3 there. We'll have your full weather forecast coming up after the break. Toronto will be holding its first by-election of the new year in just a matter of weeks. And competition is stiff. 27 candidates are vying for the job of representing the Toronto suburb of Scarborough Agincourt. The seat is up for grabs after Councillor Jim Karygiannis was removed back in September. But with a lockdown in place, campaigning has been different. Dahlia Ashry spoke to two candidates about what it's been like.
University student Renee Jagdeo and high school teacher Jimmy Dagger are among the more than 24 candidates vying to be the next councillor of Scarborough Agincourt. And there is at least one thing they can both agree on.
It's harder to reach more people because of the policies that we must respect through public health. But it's definitely been the challenge is canvassing.
I haven't been able to, knock on doors and talk to people regularly, which has definitely been a con.
Longtime councillor Jim Karygiannis retired from politics after being removed from Toronto City Council for the third time. He had exceeded campaign spending rules by nearly $26,000 in the 2018 municipal election. At only 19 years old, Jagdeo is running to be the youngest city councillor in Toronto history. And while canvassing during a lockdown has been difficult,
a pro of the situation of the pandemic has been the ability to use social media and media in general as a way to outreach.
Candidates have also been handing out flyers and promoting themselves on their websites. Dagger says he's also managed to chat with people safely.
You do see people going for walks or just shoveling outside their driveway, and just a quick conversation with them, just make sure we respect the 6 feet distance. I'm always wearing my mask to make them feel more comfortable.
Both Dagger and Jagdeo say they understand in-person voting will be a challenge for some, but they don't believe that it will affect voter turnout due to the option of mail-in voting.
I think that will allow for an increase in numbers of people that do vote.
So they can make the decision comfortably at home, and they won't have to stand in line. I know standing in line is a cause of anxiety for a lot of people during this pandemic.
Mail-in ballots are due on January 15th, the day of the by-election. Advance in-person voting will be held on January 8th, 9th, and 10th. Dahlia Ashry, CBC News, Toronto.
A Toronto doctor has given a special gift to the University of Toronto. It's a gesture intended to help Indigenous people and to honor the memory of her late son. Magda Gebrselassie has more.
A tree planted in her son's honor.
This was one of his safe places.
And a bench engraved with his name. Some of Dr. Anna Banerjee's happiest memories of her son Nathan are from this park. 2 years ago, after suffering with mental illness, he took his own life. He had just turned 14.
I miss talking to him. I miss, having discussions with him.
Nathan was from the Inuit community of Clyde River in Nunavut. Banerjee had worked in the territory for years as a pediatrician. She adopted Nathan as a baby, and every few years she would take him to visit his foster and birth families. When his biological brother took his own life at the age of 14, Nathan was heartbroken. Banerjee says he struggled with depression and schizophrenia, but leading up to his death, their calls for help were ignored.
The way that his concerns, my concerns, were dismissed is what happens on a regular basis to Indigenous peoples in this country.
So this fall, she and her colleagues at the University of Toronto created financial awards in Nathan's memory to support Indigenous medical students.
They will have a much better understanding of the needs of their communities than an outsider like me.
The president of the Indigenous Physicians Association agrees.
We continue to be underrepresented both as family physicians and in the various specialties.
She says bursaries like this are crucial.
Many Indigenous medical students come from backgrounds where, they don't come necessarily from multi-generational families of physicians or professionals, and so come from backgrounds that, may not be as financially advantaged as some of their other student counterparts.
Tens of thousands of dollars have already been raised, but they need more.
I walk forward with Nathan by my side.
Banerjee hopes the bursaries in her son's honor can be handed out starting sometime in 2021. Magda Gebrselassie, CBC News, Toronto.
And this is a shot of the Toronto skyline. It's partly cloudy in the city with a chance of light flurries overnight. Let's go to our meteorologist, Nick Cernkovich now. And Nick, a pretty mild day as far as temperatures go for this time of year, but we do have some winter weather on the way.
Hi there, Kelda. Well, we've got a little bit of a break from this sort of messy weather that we've seen over the last few days, and then we're back into some more messy winter weather, and it's really going to depend on where you are as to what you see. We'll break that down for you in one sec. Here's a look at afternoon highs for today. Temperatures above seasonal in a lot of locations. That is going to change as we head through the week as well, although by and large staying on the mild side of things, at least relatively speaking anyway. We've got some snow squall activity that continues north of the Greater Toronto area. That should generally peter out as we head through tomorrow, certainly by tomorrow afternoon. Tomorrow morning, still a few lingering flurries there. By and large, looking at sunshine across southern Ontario, but then as we head through tomorrow night, we're looking at snowfall with our next system, starting in and around the Windsor area. By the morning, it begins to push into the Greater Toronto area, and we've got a transition to sort of a rain-snow mix and then rainfall down around the Windsor area by the morning. Same story by the afternoon as we head through the Golden Horseshoe. Snowfall out toward Ottawa by the afternoon on Wednesday, and then as we head through Wednesday evening, generally a rain event along the north shores of Lake Erie and Lake Ontario, right out to about Kingston, but snow remains in the Ottawa area through Wednesday, and the whole system pushes out as we head through Thursday. So we'll show you that in the five-day forecast, how it really varies from Windsor to Toronto to Ottawa just because of the track of this system. There's a look at your forecast heading through tonight. -7 degrees in the Windsor area, wind chills to about -11. Tomorrow, pretty good looking day there, -3. Lots in the way of sunshine. Golden Horseshoe, looking at temperatures a little bit cooler with a few flurries from those snow squalls lingering tomorrow, -1 as daytime highs. And then as we head out toward the Ottawa area, overnight tonight, we're looking at temperatures that will hover in the minus double digits. Still kind of gusty with the winds there, -9 for tomorrow in Ottawa, but lots in the way of sunshine. There's a look at the forecast for Windsor. Mixed precipitation on Wednesday, warmer temperatures. Toronto a little bit cooler on Wednesday with that storm system. Mixed precipitation as well, but a snowfall event for Ottawa, looking at about 5 centimeters on Wednesday and 5 to 10 with another system as we head into Saturday. Let's check on your forecast, Kelda.
Thanks so much, Nick.
The weather is brought to you by Trane, the most reliable heating and cooling brand. We test, so it runs. It's hard to stop a train.
There'll be love and laughter.
Music therapy is a way for seniors to combat isolation during COVID-19, while experts say it's increasingly important during the holiday season. That's coming up next. Finally tonight, the pandemic has been tough on vulnerable populations, especially the elderly. For those with dementia, having to deal with social isolation can make the disease even worse. Farah Morali takes a look at how music therapy is helping seniors feel more connected.
Friends shaking hands, a familiar song that stirs a smile and more.
A lot of families are calling us, and right now especially saying that their family members very isolated.
Since the start of the pandemic, Maya Adut has been busy with requests for her services as a certified music therapist.
A lot of seniors living with dementia tend to have social isolation as a primary concern. So they're just looking for somebody to really build a connection with their loved one, and they know that music is a really great way to do that.
There'll be love and laughter.
Adut and her team pivoted from in-person to mostly virtual sessions with the help of staff in homes.
We bring the iPad up to the individual suites, and we're there and connecting with them. We're so fortunate to be a part of that process now with them, and that way we can keep them engaged.
For some relatives, those services have been a lifeline during the pandemic.
When COVID hit, we noticed that Mom was really going downhill. So, the communication skills almost stopped.
Kathleen Biggs's 87-year-old mother Betty lives with dementia. She signed her mother up for one-on-one virtual music therapy sessions when her social programs were canceled. Biggs says she sees a difference after every session.
She's much more communicative, and it makes such a big difference to the family. I just find that through these sessions, that at least for a period of time afterwards, that I get a little bit of my mom back.
And there was a science behind it.
Music impacts our physiological processes. It can impact our heart rate, our respiratory rate, our brain wave.
U of T assistant professor Amy Clements-Cortez has conducted extensive research on music therapy.
For a person that has dementia, oftentimes they're still able to connect with music from their youth. So music from late teens and early 20s often remains intact. And so if we can target that music, and we can also find out what the client preferred music is, then we have a chance of reaching into them and for them to access memories.
Many care homes cut down staff and programming during the holidays, which is why Clements-Cortez says tools like virtual music therapy will be even more vital to prevent isolation. I think to myself,
what a wonderful world.
Farah Morali, CBC News, Toronto.
And that's our show for you tonight. Thank you so much for watching. Chris Glover has your next newscast tomorrow at 6, and I will see you back here tomorrow night at 11. Have a great night, everyone.